This morning we did the pharmacology test. If you didn't know when you did it out in the parking lot or wherever the hell y'all asses was, if you didn't know how to pull it up correctly, we pulled it up going to client's needs, because it's not enough to do pharmacology. You need that medication administration part of that, okay? So if you didn't know what you were doing when you pulled it up, just make sure you focus on that next time. We also told you do not study math. Why did we say do not study math? What was our reminder about that? What was it about math that you didn't have to worry about?
2% only get it.
Yeah, about 2% will get a math question, and of that 2%, you're only going to get one. And it will not make or break you, because it says it right in the actual testing manual. It will not help you pass or make you fail, so why bother, right? Now that is said for the test, but here's your reality. Your reality is that when you start your first job, they're going to give you a math test, and much of it won't even be math. It'll be medication administration, what insulin syringe to use, that kind of stuff. So what we say to you once you pass your test, which I'll probably call the little baby Michaela and tell her, make sure you study medication administration and pharmacology when she gets her job. What I tell you guys is the minute you pass your test, you're not done yet. Start your math. Start looking at math stuff. Start looking at pharmacological administration, all that stuff. Even though you don't have to worry about the big test, you are officially a nurse, you will have a math test literally the first day of work. And it hits you hard like you got this the first day. Oh my God, that's not right. You know, like people are pretty shocked by it, okay? So a lot of it has to do with syringes that you use, how to read a syringe. It's kind of easy, super easy, like incredibly easy, except for the part about the syringes to use if you don't work in this. Now, I've been a nurse 40 years, just so that you understand why I don't give a fuck about math. I have yet to do a math question at work. Do you really think they would trust our punk asses to do math and kill people when we can't hardly get the shit they give us right? In other words, there's so many med errors that could kill people. Why put a whole hospital at risk with a bunch of people doing math? Are you kidding me? I'm so very glad they don't trust my punk ass, because everybody would be dead. So you just need to know I've never done math since I started this career. I don't anticipate all of a sudden they're going to make you do any math, or you should be physics. You should have majored in physics in that case, okay? So let it go, stop worrying about it, but then hit it up once you do pass your Nclex, because it kind of fucking matters, okay? Now, so what I did, and I haven't done it in a while, is I made a case study. The bad babies are seeing it for the first time, so I'm going to read it over. The good babies are going to tell me what they did on their lunchtime homework. So let me just read it over. So what I mean to tell you is how many case studies might make the test? How many? What's a minimum? There may be 6 case studies on the test, but you get it wrong when you say 6 is the minimum. What is the minimum? 3. So I need you to know, if you take a test, and if you are on your phone, get out, because you're not paying attention. So put your phone up. Now, so here's the way this goes. You have a minimum of 3. What's the maximum I've seen? I don't know, 10, because they got all 150 questions. But you have a minimum of 3 case studies on the test. Average is 6. That's where you got the 6 from. The case studies that we see on the test are common themes. If I were you, I would look on page in your Oh My God packet. If I were you, I would go to page 20. I would go to page 22. Okay. Now, so On that page, you're going to take notes at the bottom on how to nail this, right? So here's what you got to remember. How many did we say was minimum?
3.
How many questions per case study?
6.
How many questions total is that so far?
18.
I failed math too.
18.
18. So here's where I'm going with this whole conversation. What's the maximum number of questions on the test? 150. What's the minimum number?
85.
Okay. What do they throw out? How many?
15.
15. If they throw out 15 every single test, now what's the minimum? I failed math too.
70.
Thank you. See, I'm gonna have to look at you because I failed math. So 70 questions really matter. Are you still with me?
Yeah.
If 18 of those are case study questions, can you see how this can be fun if you just know how to do a case study? Okay, that's where I'm going with this, because I'm trying to let you understand that 20% of your test is a case study. All right, now, that being said, there's a way to approach this in a way that you're kind of like ready for it. What are the top case studies? This is one of them. Postpartum hemorrhage. It's in your favorite subject because you hate it. It's maternity. So you can throw darts at me or tomatoes, whatever, but we're gonna do this shit, okay? So when you look at this case study, it's a postpartum hemorrhage. Why is this a very big part of case studies? Just like preeclampsia is, hint, hint, preeclampsia is, because those two things kill women in this country. This is the main reason why you die. If you know anything about women dying in America, you know we have the highest maternal infant mortality rate out of all wealthy nations. The highest. They are dying from one or two issues, women in America. It's either a postpartum hemorrhage that killed them, or they died from preeclampsia. That's the two big killers, y'all. And for your test, maybe they ask you what's the most common reason women die in childbirth. They're not gonna say preeclampsia, everyone. They're gonna say hypertensive issues or emergencies or conditions, okay? I want you to remember that. Hypertensive conditions, okay? So that's kind of like important. So it's kind of like, your job and mine is to kind of not have anybody die on us. And you may be thinking, well, Shelley, the likelihood of me working in maternity is slim to none. That's true. But what we see now, because of the current state of affairs, is we see if you work in any critical care at all, whether that's the emergency room, ICU, SICU, any of those areas, this could be your patient, okay? Y'all got it? Okay, so now let's look at it, because I use a lot of abbreviations. And so those of you who just came back to class, I want you to see what exactly is she writing in all this gobbledygook on the board. And this is and make sure you know what this is. This is handoff report. So this is change of shift, handoff report. She's giving this report that I'm about to read to you to the oncoming nurse. She worked day shift. The next nurse, she worked day shift. This nurse is starting at 7 p.m., okay? Now, when it comes to the case study, each case study that's unfolding has 6 questions. The first question and the second question are gonna have to do with recognize and analyze cues. You already know that. I'm not gonna bore you, but that's reality. If you forgot that, no problem. It's written right here in your Oh My God packet. Number 1 is recognize, number 2 is analyze, and then we got this. So here we go. 38-year-old, so the Y and the O is year old, gravida 6, para 5, spontaneous vaginal delivery at 6:20 p.m. with no known drug allergies. She came in at 4, I'm giving a report, pretend. She came in at 4 p.m. after she broke her water, spontaneous rupture of membranes, and labor pains started immediately after her water broke. She went pretty quick. Her estimated blood loss was 300 milliliters. She did have a 2nd-degree laceration. It was repaired. She had a baby boy, 9 pounds 6 ounces, 4252 grams. The family desires circumcision. She breastfed for 15 minutes. The APGARs were 8 at 1 minute, 9 at 5 minutes. The baby's blood sugar is 49, and this was at 6:50 p.m. The IV that she has up right now has lactated ringers with 30 units of Pitocin. It went up after delivery. 500 is in so far. So she got half the bag so far. She has an ice pack to her perineum. She has 2 18-gauge angiocath IVs. So she has one in her left hand and another one in her right hand. Her fundus was firm and at midline at the umbilicus, and she voided ×1, 200 milliliters at 6:50 p.m. Her vital signs include temperature 36.9, pulse 108, blood pressure 100/62, her respiratory rate is 20, her pulse ox is 98% at 6:55 p.m. Her pain, she rated 2 out of 10, and she declined any pain medication at this time. She is O negative, rubella non-immune, and she's group beta strep negative. So that's the report. And so I'll ask after I give the report, do you have any other questions? She said, no, this is our report. Now, so what I told the good babies to do that the bad babies didn't hear is I told them to make sure they do page 17 of your Oh My God packet. So I'll give you a minute to turn to page 17.